Good morning. Today we are talking about or discussing the first technique in suturing techniques, which is simple interrupted technique. For each suturing techniques, we have certain principles. One of them, as I told you, grasp the needle in the 1/3 of the needle. The second one, regarding the entrance to the tissue. Almost always, you should start 2 to 3 millimeter away from the edge of the cut or the wound or any laceration that you are going to suture it. Don't start too near from the edge or too far, because too near cause laceration and too far make it impossible to close the wound. So we start 2 to 3 millimeter away from the edge of the wound, and we should grasp the instrument with the tissue forceps, grasp the tissue, then making our entrance and exit. Regarding the entrance and exit, we can do it with one step, going from here to here, or 2 steps. Now we are trying to do it in 2 steps, like that. Entrance 2 to 3 millimeter away from the edge, then removing the needle, also exiting on the same line for better healing appearance, 2 to 3 millimeter away from the edge, grab the needle, remove it. Then we are going to tie our knots, and we have surgical tie. The surgical tie is like that. We just hold the needle holder like that, wrap the suture material twice around the needle holder, grab the tail and bring the tail toward yourself. Sorry, there's a tag. Wrap it twice, then grab the tail and bring the tail toward yourself. This is the first knot. The second one, to complete the knot, but not sufficient to hold the knot, is that one anti-clockwise, then grab the tail and bring it to other side. But this is insufficient for securing your knot, so you should do the third one. The third one also like the first, twice wrapping it around the needle holder, grasp the tail, bring the tail toward yourself. And that's the surgical knot. And regarding the cutting, it should be also 2 to 3 millimeter away from the knot, because too close to the knot, it will untie it. Too far, it will be unpleasant for the patient, and the patient may cut it by herself or himself. So 2 to 3 millimeter away, we do our cuts.